Dr. Silver, I see you're smiling. Good afternoon. How are you today?
I am great. I'm so excited to be here, Dr. Eisen.
All right. It's very funny. We just came from Paul's joke of the week, and now I
Yeah,
get to see a smile, happy face. Obviously, you liked his joke. So,
absolutely.
again, thank you for joining us on our Injured Federal Workers podcast. Can you tell us a little bit about yourself and your practice and all the rest?
Sure. So my name is Warren Silver. I've been doing injured federal workers
Dr.
comp
Warren
for,
Silver.
yes, sir. We're among friends.
All right.
Um, and I've been doing it for a little over 7 years. And I stumbled upon it completely by accident. I had a patient, a dear patient of mine, whose son was involved in a car accident. And the car accident really involved, he was a postal worker who was driving his postal truck and was involved in an accident on one of our local highways here in Baltimore, Maryland. And I've had experience dealing with motor vehicle accidents and treating state comp and things like that. And I went through what I thought were the appropriate channels, only to find out that his case was denied and none of his treatment was approved. And needless to say, I wasn't paid for anything that I received. So in investigating, trying to find out what I did wrong, I realized that federal injured comp, workers' comp, is a totally different animal from state workers' comp or even regular motor vehicle accidents. Through many trial and error and with help of a very close colleague of mine, we try to we put it all together. And now we've been doing it now for a little over 7 years. And the practice that we have here, we have, excellent muscle therapists. We have an exercise assistant for rehab, and everything is very hands-on. We don't just throw people into an exercise room and say, here, ride a bike or everything like that. Everything is very hands-on. And we work with different attorneys, different medical doctors involved with helping people getting their claims accepted. And allowing people to get the treatment that they so desperately need.
So I think you would agree with me on this, that the federal patient, and it's a good thing to say it like this. Actually, I just realized the light is off. I'm putting the light on. I got the light.
Oh,
Okay.
there you go.
One thing that you would agree with me is that the federal patient requires a lot of attention to all details, therapy-wise, which is good. It's not bad, right?
Right.
Therapy needs a lot of attention because you want to get them better.
Right.
Paperwork needs a lot of attention because it requires all the documents to be filed promptly, done correctly, right? You don't put your signature in the right spot, everything gets denied, and so forth.
I's dotted, T's crossed, everything has to
Right.
be on point.
So what's one thing that you've noticed that most federal patients have difficulty with? And it could just be that original story of, hey, the paperwork, something's wrong, and that's really where
Well, it really does boil down to the paperwork, particularly the doctor's report. So when I was seeing this patient, I did not know how to write an appropriate medical report as far as the Department of Labor was concerned. I can write a medical report that if I were sending a report to you, Dr. Eisen, you would fully understand what's going on with this patient and know exactly, what needs to be done, but that does not pass muster when it comes to the Department of Labor. So learning the 5 factors, learning causal relationship, how we have to explain how did the particular incident actually cause the injury and go through the mechanics of it all,
right,
is what really the problem. And I think that's where many of the patients that I have that come to me because their cases have been denied is really for that factor of causal relationship.
okay.
And they depend on me and the attorney on putting together the appropriate documentation report so we can get there. And once the case is open and accepted, so now they continue to follow up with me so they get the desperate care that they need.
Do you have an interesting story that you don't mind sharing regarding federal workers' comp?
Yeah, this is just recent. This is going on the past month, so it's fresh on my mind. I had a particular patient who is a postal worker and had tripped and on the steps and banged their knee. She was sent, she did everything that she was supposed to do. She called the supervisor. The supervisor came out to the scene and they sent her to here, at least in Maryland, it's called Concentra,
We
which
have that too
is,
here in New
yeah,
York.
which is with the post office where they send, one of their clinics. She was examined and she was given a diagnosis of a contusion. She banged her knee, was given, a day or two off of work, sent back with some restrictions, and she was still in a tremendous amount of pain. And she went back to Concentra numerous times. They did actually some physical therapy on her. And then after, I think it was maybe 8 weeks, maybe 10 weeks, they finally sent her for an MRI. And the MRI revealed that she had a torn meniscus. The doctor from Concentra never updated the report to ask for an expansion of the case. It was just left as a contusion. And after a period of time, the Department of Labor said, okay, look, for a contusion, there's no reason for you to stay out anymore. You're going back, no restrictions,
It's a bruise.
and work, and it's a bruise. And that she did. She did everything. She followed her doctor's recommendations, and she went back even though she was still in pain. Well, she worked without restrictions, I think, for another couple of months, and the knee got so bad that she can barely walk on. She went back to the doctor in Concentra. That doctor referred her to a different Concentra facility, believe it or not, who saw another doctor who ordered another MRI. This MRI revealed now the tear had gotten worse. And her original, so she was told to file a recurrence injury. A recurrence injury, meaning
which
that
is all baloney, but we'll explain it another episode.
Right, which is incorrect. And needless to say, that claim was denied.
Right.
Now she comes to my office. So after examining her and looking at the MRI, really this is a new occupational disease injury because there was a worsening of the tear, and we had the before and after proof of the 2 MRIs.
So let's just stop right here, if you don't mind.
Sure.
Well, just to review, the definition of an occupational disease claim is that it happens in more than one period of time, in more than one shift. So being that there was a period of time from the first MRI taken till the second one, that's multiple visits, multiple shifts, multiple weeks and days and months and whatever else, now you have what's called an occupational disease claim.
Correct. So that's the case. That's the claim that we're working on with her now. She filed the occupational claim, and we're waiting for that case to be approved. In the meantime, though, I also helped her. She started seeing a different doctor, not related to Concentra, and that's something that your audience needs to understand also, that they are allowed to choose their own doctor, but their doctor needs to understand how the Department of Labor operates and the whole report writing system. But she does now have a doctor who is it's her doctor who's part of the Federal Workers' Comp system and understands. But so she's having, with our help, to have the first claim expanded to include the initial tear. So
Beautiful.
Now she's eligible for all of her Department of Labor benefits that she was denied initially because it was just diagnosed as a contusion.
Just to follow my own surgery, orthopedist wants surgery on it?
So not yet, and especially that may change once her claim is, because an orthopedic surgeon isn't even touching the case because there's nothing open.
Okay.
And understanding that even though she has her regular health insurance, because everyone is aware that this happened on the job and she's a federal employee, they're not touching it until the claim is open. So she may need surgery, she may want surgery, but right now she's dead in the water until we can hopefully, successfully get this open.
Do you mind sharing your web address and your office phone number so if people want to reach you and... Yeah, please.
So I'm located here in Baltimore, Maryland. The number is 410-298-3100. We do have patients who, travel from southern Pennsylvania, from northern Virginia, from Washington, D.C., which is within an hour. But I guess to my benefit, there aren't too many doctors who do what we do here, so they're willing to travel. The website is my name. It's Dr. Dr. Warren Silver, WARRENSILVER, like the color.com. So it's drwarrensilver.com.
Well, and for those of you who are going to see our commercials, you sponsor one of the commercials on our podcast. So He's been vetted. He knows what he's talking about. So just keep that in mind. Any other thoughts or comments maybe before we go that you want to leave the audience with as it pertains to federal workers' comp?
Yeah, I've seen a lot of patients who unfortunately we can't help. Not because we can't help them with their injuries, but we can't help them with their claim because too many things have gone on, too many errors have been made.
Yes.
That leaves the question from the Department of Labor's perspective. My approach has always been, if I have to testify in front of a jury, can I explain in a very simple form within a reasonable degree of medical certainty what the situation is? And there are those cases that because it's gone on for so long or they've seen too many doctors who did not know what they were doing, there's always going to be that question in the Department of Labor's mind that no matter what we say and what we do, chances of having their claims accepted, unfortunately, are slim to none.
Okay.
So just, I encourage people to find a doctor who knows what they're doing, and don't be afraid to ask that question. How much experience do you have in dealing with injured federal workers? Are you a certified or recognized doctor among, in the Department of Labor's, and all that information can be found online, and I'm sure you'll provide to them the website. They can check who's an approved federal workers comp doctor.
And just because they got approved, it could have just been because of bills to get paid because they treated someone.
That's
Doesn't
true as
necessarily
well.
mean that they know what they're talking about. So for instance, I tell people, like, I created an ebook, and I know that you're interested in doing something similar in different areas.
Absolutely. Always learn from the best.
But the point is that the reason the podcast is to educate. The more you educate someone, the more information they have, the better they are at handling it. So when you know that you've seen hundreds of cases, not 5, not 1, hundreds, and you know what you're talking about, and you have the podcast, and all you listeners out there, please pay attention to all the information that's given at every episode, because we're walking you through what you should expect from the doctor's office and what you shouldn't, whether it's a CA 17 or 20, right? Like, how quickly should you get a 17 or 20, right? It won't be right away. It won't be right because you don't have a case number. But people don't know that. The post office tells them, or the federal agency tells them, we need to have the report. But without a case number, you don't have a report to send up to somebody, as an example. And that's where the frustration lies with them. They become frustrated. And we can go on and talk about.
So I'll end with this note, and I know that you are great. You've lectured, you're out in the community, you're in your office, you're doing these podcasts, you're doing the ebook and things like that. And I also lecture in the public, and some of the local unions that I've lectured, and I let them know before I lecture. I say, look, I'm going to be completely honest with you. I'm not doing this simply because I'm here to help the public and you, because the truth of the matter is it helps me too, because when people are educated and they come in with a case that isn't a mess and isn't in shambles, it makes everyone's life a whole lot easier. So I'd rather educate and get ahead of the 8 ball than try to play catch up all the time and deal with patients who are frustrated. They're not getting paid. Their work is giving them a hard time, and the case isn't open. The doctor doesn't know what to do, and
fix my problem today.
And fix my problem, right? So this is a preemptive. The reason we're doing this, I believe, is 100%. Preemptive. So it's better. Education is power. Knowledge is power. So the more educated people are, they're getting off on a better foot than trying to correct something problem.
Correct.
So that's the honesty.
Wonderful chatting with you. We should do it again. I'll maybe call you back in a couple of weeks, or you'll call us and say, hey, I have an interesting story. Let me tell my story of the patient, because that's how the audience is going to learn, because they're into that stuff, and they're realizing that
they can relate.
And they can relate. Yep. Have a great one.
Thank you. You as well, Dr. Eisen.
We're going to commercial. Maybe it's Dr. Silver's commercial. We'll see. Tune in.
Bye.
Bye.